morning and welcome to this morning's Ministry of Health and Wellness press conference. As you know, it's been a tough few weeks in Belize with the recent rise in cases and deaths related to COVID-19. I'd also like to take this opportunity to express our condolences to the families of especially the Honorable David Vega and also the families of Doctors Kevin and Kenneth Guerra. As I said, we're here because we've seen a recent spike in not only cases and deaths, and so we're here for an update on the current situation in Belize, as well as the rollout of the new regulations that will be announced today. Before we move ahead, I'd like to introduce our head table today. With us is the Honorable Michelle Shabat, Minister of Health and Wellness, the Attorney General, Honorable Magali Marinyong, who is accompanied by the Solicitor General, Ms. Elisa Montalvo. Also with us is the Honorable Karim Musa, Minister of Home Affairs and New Growth Industries, and as well Honorable Anthony Mahler, Minister of Tourism and Diaspora Relations. Also here we have the Acting Director of Health Services, Dr. Melissa Diaz, Dr. Natalia Baer, the Technical Advisor for Maternal and Child Health at the Ministry of Health. We have the National Surveillance Officer, Nurse Lerna Perez, and also the Chairperson of the KHMHA Board, Dr. Andra Sosa. We'll get right into it, and so I'd like to now invite Minister Shabat to make the opening remarks.
Thank you very much. Good morning, everyone. Good morning, Belize. Today is an update on the COVID situation in our nation. Since we were here a few weeks ago, these are the numbers we have so far. We have done a total of 52,217 tests. We have a total of 9,791 confirmed cases, 8,053 total recoveries, 530 persons under investigation, and that includes the backlog, which has gone down from the 3,000 plus when we took office a month ago. Currently, we have 1,526 active cases and sadly 213 deaths to report. These are all cumulative numbers. Again, my sincere condolences go out to all who have lost a loved one to this dreaded virus. With the increase in rapid testing throughout the country by public and private facilities, we have been able to test, detect, and isolate an increasing number of persons with COVID-19. As promised, we have rolled out rapid testing and we have instituted mobile units that are now also doing the rapid testing for COVID-19. And some of the areas we are now covering include in Orange Walk, the People's Stadium, which we attend on Tuesdays and Fridays. And in the high-risk communities, we have the mobile units visiting twice a week. In the Stan Creek District, we have the Pomona Health Center, the West Track construction site, and the Dangriga Police Station, and the Banana Farms. In Toledo, we have visits scheduled to San Felipe today and Jacintoville today as well. And on Tuesday, our mobile clinics will be visiting the San Antonio Village and the San Pedro Colombia Village. That is going to be on Tuesday, the 22nd of December. In the Cayo District, we have visits scheduled to Benqueviejo, Santa Elena, and both the mobile units will also be at the health centers starting on December 21st, 2020 on alternate dates. In Camalote, we will be there on Tuesday, December 22nd, 2020. Throughout this period, we've been constantly asked what is causing the increase in the numbers of cases. Current evidence suggests that the main way the virus spreads is by respiratory droplets among people who are in close contact with each other. This means that our human behavior is contributing to the spread when we continue to disregard the recommendations and regulations set forth by the government. We as a government are determined to do all that we can, and we will stop at nothing to make sure that the Belizean people are safe. It is with this in mind that we are going to be adopting the following measures, and I will only go over them very briefly as Minister Musa will give you more details. But starting on the 20th of December, the curfew being imposed will commence at 8 p.m. and it will go to 5 a.m. For minors, children under 16 years old, the curfew will begin at 6 p.m. and that will last to 5 a.m. The sale of liquor will be restricted from 6 p.m. to 7 a.m. with the exception of those restaurants that are in hotels. There is now going to be a penalty for persons who have tested positive and are not adhering to the mandatory quarantine. The penalty for not wearing a mask will continue. We are now introducing a restriction to public transportation where buses and water taxis will only be permitted to carry 50% of their seating capacity. In terms of businesses who violate and employees who violate these regulations, a $200 fine will be imposed on employees and on employers a $5,000 fine, and a second violation by employers will result in their business being closed for a period of 7 days. We're also going to be imposing a fine for those people who continue to have parties at their homes. Businesses are only going to be allowed a 50% customer base, which is going to be based on their square footage. We're introducing a limit to non-essential travel, inter-district travel from Corozal and Orange Walk districts. The concept behind limiting this non-essential inter-district movement is very simple. In view of the fact that we are unable to sustain the type of protracted nationwide limitation of movement of the nature and scope that we have seen in other countries, the localized inter-district movement limitation instead seeks to attain a fall in the incidences and overall rate of transmission at the municipal and subnational levels. These measures, which are going to be affecting the Corozal and Orange Walk district primarily, are born out of the fact that we have seen increasing numbers throughout these two districts. We've seen increasing numbers in Libertad, Paraíso, Pachacan, Progreso, San Andres, San Joaquin, San Pedro Village, San Roman, and Santa Clara. And in the Orange Walk districts, we're seeing increasing numbers in Douglas, in Guinea Grass, in the town itself, in San Luis, in San Antonio, San Jose Palmar, San Pablo, Tower Hill, and Trinidad. And so it is our expectation that with this limiting of inter-district travel, it will contribute to the lowering of the numbers of infections. I will defer in a moment to Minister Musa, who will get into the particulars of the additional regulations we're going to be imposing. But just to give you a brief of what we have done since our last press conference, We have updated our treatment protocols, and we now have added new medications and treatments such as ivermectin and the use of convalescent plasma. We have also launched a Christmas educational media campaign, and you can see some of the banners are displayed here, with the objective of sensitizing the public on specific behavior changes necessary to reduce the spread of COVID-19, especially during the Christmas season. It is centered around the theme, "It is better to have a safe Christmas season than to attend a funeral during the holidays." This media campaign will continue throughout the Christmas holidays up until January, and thereafter a further campaign will be launched to continue with the sensitization of the public. We are, as of Monday, embarking on the distribution of face masks to the population. Again, we are trying to do everything we can as a government to ensure the safety of our citizens and to help to make sure that we give you everything you need to be able to be safe. We have formed a COVID-19 response team that is headed by Dr. Melissa Diaz and includes Dr. Daisy Mendez, Dr. Natalia Largaspera-Bier, Dr. Pedro Arriaga, Dr. Andre Sosa, Dr. Fernando Cuellar, Dr. Victor Rosado, Dr. Jorge Hidalgo, Dr. Marcelo Coyi, Nurse Lorna Perez, Dr. Andre Coyi, Dr. Eric Bradley, Dr. Mark Musa, Dr. Anastasio Cobb, Dr. Francis Murray, and Nurse Melinda Guerra. We have also issued invitations to the opposition, the NGOs, and the business community to appoint a medical officer to represent them on the COVID-19 response team. Additionally, it gives me pleasure to report that Dr. Marvin Manzanero is expected to be released from the hospital, if not today, then by tomorrow. I know that one of the questions everyone has been asking is, what about the COVID vaccine? And just very briefly, the Inter-American Development Bank is collaborating with the government of Belize through a new operation with the objective to strengthen the national response to COVID-19. The overall objective of the operations is to contribute to the reduction of morbidity and mortality caused by COVID-19 and to mitigate other indirect impacts of the pandemic. The specific objectives are to support the effort to interrupt the transmission chain of the illness through ensuring timely availability of the vaccine and strengthening the vaccine logistics and supply chain management. The new operation will focus on 4 areas. 1, procurement of vaccines and other inputs, define and reach the target population to be vaccinated, assist with health personnel and logistics, assist with organization and general and process management. In addition, the government of Belize has entered into an agreement with Gavi, which is the Vaccine Alliance, for the procurement of 238,000 doses of vaccine through what is known as the COVAX facility. The amount of doses is intended to cover initially 30% of the population at greater risk of contracting the virus and would include the elderly and persons with chronic disease and the protection of those caring for COVID-19 patients, healthcare workers, and other vulnerable populations as more vaccines become available. The agreement between the government and Gavi Alliance was signed on the 18th of September 2020. The IADB did the first down payment of $383,000 in October on behalf of Belize, and the remaining $2,137,000 is a guarantee that has to be filled by the end of March 2021. I wish to also take this opportunity to thank our healthcare workers, other frontline workers, and our partners who have readily assisted the people and the government of Belize in the fight against COVID-19, especially UNICEF, UNFPA, PAHO, UNDP, the Inter-American Development Bank, Scotia and Belize Bank, the embassies of Taiwan, Japan, China, Cuba, many other local businesses, the police department, BDF, and NEMO, BNE, BAHA, the Ministries of Education and Human Development. At this point, I want to pledge my commitment and the commitment of the Ministry of Health and Wellness to do all in our effort to stem the spread of COVID-19. And before concluding, I wish everyone a safe and Merry Christmas and a happy and healthy New Year. Please follow the instructions, follow the regulations that the government and the ministry will be implementing. It is for your safety and it is for the safety of your families and loved ones. May God bless Belize and may God bless all of our citizens and residents. Thank you very much.
All right, thank you, Minister Shavat. At this time, I'd like to invite the Honorable Karim Musa, Minister of Home Affairs and New Growth Industries, who will be giving an overview of the enforcement components for the new regulations and speaking to specific new regulations that have been included.
Good morning, ministers. Good morning, Attorney General. Good morning to the members of the press. And of course, good morning to all Belizeans at home and abroad. It has been 270 days since the first case of COVID-19 and 265 days since the first measures were taken to try to slow the threat of a virus that no one saw coming. Last night, we all sat in front of our televisions at 6:30 anxious, while the heated public debate from taxi cabs, market stalls, hair salons, chat groups, and bus stops over whether we should have another lockdown or whether Belizeans had the self-policing skills to carry out ourselves through the upcoming Christmas season. The local news last night was a clear example of how balance is as much a cure as social distancing. So where is the balance? A declaration that we recognize that hard restrictions need to be put in place but not sacrifice the soul of the Belizean man, woman, child, and family? Well, these are the measures. I know a lot of what we will be discussing will be a repetition of what was in place before, but it is extremely important that all Belizeans recognize that these measures are still in place and that we must adhere to these restrictions. First of all, generally speaking, if you are at home watching this right now and you are experiencing flu-like symptoms and you believe you may have COVID-19, you are asked under these regulations to please call the Ministry of Health, who will then decide whether or not you are an individual who needs to be quarantined. Those of us Belizeans who test positive for COVID-19 can only be discharged and declared recovered by a healthcare professional. So if you have tested positive, you will be put on mandatory quarantine. Please do not leave your quarantine or your isolation until you have been discharged or declared recovered, again, only by the Ministry of Health or a healthcare professional who is following those protocols. As the minister just mentioned, we will now be having a nationwide curfew, and that is starting on the 20th of December, and it will commence at 8 p.m. So 8 p.m. every evening, you are to be at home, and that goes until 5 a.m. the following morning. Minors, anybody under 16 years of age, must be at a residence or their home that they are staying by 6 p.m. So it is different for minors. You have to be home by 6 p.m. and that curfew extends to 5 a.m. the following morning. This curfew of 8 p.m. excludes workers in the following professions: the security forces, Customs and Excise Department, the Department of Immigration Services, frontline healthcare providers with the Ministry of Health, or any other essential worker issued a badge by the Minister of Home Affairs. So everybody else has to be at home by 8 p.m., minors by 6 p.m. Face masks. You must be tired of hearing about face masks, but every single day the police department is arresting and detaining, in some cases, hundreds of individuals violating this very measure, the wearing of face masks, and wearing face masks properly, meaning it must cover your nose and your mouth. There is no need for you to wear face masks if you are at a private residence, if you are exercising, swimming, if you are driving alone, or driving with members of the same household. Those are the only exceptions. In terms of businesses, no owner or manager of a business should allow entry to anyone who is not wearing their face mask and wearing it properly. So there is a responsibility being placed on owners and managers of establishment. Please ensure that your customers are wearing face masks at all times. It is an offense not to wear face masks and not to wear it properly, and the charge for that offense is $500. You will recall that there was a maximum that was imposed under the last couple SIs of $5,000. Well, in practice, at the magistrates court level, we saw where the magistrates were fining people between $500 to $1,500. Much of those fines have not been paid, but in fact the police is going to be following up on those fines, so you have a responsibility to pay that. That fine is now across the board $500. The Attorney General's ministry is currently drafting legislation that early in the new year we will be presenting, so that police officers can issue tickets. So that is not in place yet. So you will still be detained, you will still be taken to the police station process, and you will still need to go to court at least until that law is passed. So please be aware of that, that it is not a ticketable offense at this moment, but early in the new year, we will be moving in that direction. Social distancing. You must stay 6 feet apart from any individual that is near to you. No matter where you are, 6 feet apart. That is also an offense. So whether you're working at a BPO, whether you're just standing in a line outside a shop, you have to maintain 6 feet apart from individuals. That is an offense, that carries again a $500 penalty. Gatherings. I know that at this time of year, many people are questioning, can I have anybody over at my house? No. You are not allowed to have anybody at your house. So no type of private gathering is allowed. You cannot organize, host, or attend private gatherings. 10 people maximum. So every now and again you might have a visitor. Unexpected. That's different from hosting a private gathering. You can have a visitor, but make sure it is never over 10 people. The moment you're over 10 people inside your residence, then everybody can be charged under this SI. Everybody. The person who owns the house and those who are attending that private gathering that has more than 10 people. This, of course, we have to bear in mind that there are households that have more than 10 people that reside there. So of course you are allowed to stay there if your household is more than 10 people. So that is of course the exception. Otherwise, no hosting of any private gathering. We have set up, especially for this time of year, a special hotline at the police department. And that hotline is 0800 parties. So we're asking you, the members of the public, to cooperate with us in the Ministry of Home Affairs to report anybody that is having a party or a social gathering that is over 10 people at their residence. So 0800 parties, 0800 727 8432. In terms of weddings, funerals, and masks, so church will be limited to 10 people in attendance at your wedding, in attendance at a funeral for your loved ones, or at mass. And that 10 will be in addition to, of course, the officiants, meaning the priests can be there. So that would be 11. So again, 10 people attending mass, weddings, funerals. The following businesses shall remain closed: bars, nightclubs, casinos, gyms, and gaming establishment. All of them are to remain closed during the term of this SI. Other businesses that are allowed to open under these regulations will have responsibilities as well, and this goes for government offices, this goes for shops, this goes for BPOs. Any business whatsoever across the board must follow these guidelines and these restrictions. As business owners and offices, you must ensure that the people inside, the customers, the staff, both inside and outside the building, maintain 6 feet distance at all times. So if you heard me correctly, inside and outside. I know there's a very popular fast food restaurant on Freetown Road. Whenever you pass there, you can see a lot of people gathered out there, and they are not practicing social distancing. So business owners, please be warned that this applies to outside of your business as well. So you will have to set up markers that are 6 feet apart, and you must ensure that those customers are practicing social distancing. In terms of inside your building, business owners have to ensure that customers, including staff, must not make up more than 50% maximum capacity of your building. So if your building can hold 100 people, which includes customers and staff, you now can only have 50 people inside your business. Again, outside your business, you must establish under this SI, you must place visible markers which are 6 feet apart outside of your establishment. That is the obligation, not of the police. I am not going to go out to your establishment and mark where the 6 feet stations should be. That is a responsibility of you, the responsible corporate citizen, to ensure that you are complying with this particular SI, because if not, I'm not going to be the one to get into trouble. You will, because you did not establish the markers. In addition to that, department stores, hardware stores, dry goods stores, shops, and the market shall ensure compliance of the store owners. So we are going to have, in relation to these specific businesses, department stores, hardware stores, dry goods stores, and shops, we're going to have justices of the peace assigned to your business. If your business is more than 2,000 square feet in size, we will have justices of the peace assigned to your business, and you will be responsible for paying the cost of having these justices of the peace. It is very regrettable that we have to impose this particular measure, but at this time of year, especially the next week up until Christmas Day, businesses will be overcrowded. And I am certain that businesses are not going to be concerned about whether there's social distancing being practiced. They'll be concerned about making money for their business. And so we're taking that responsibility and giving it to the justices of the peace across the country to now monitor, one, that there is social distancing being practiced within your stores. Two, to ensure that you are meeting the maximum 50% capacity and that you are not going over that. And three, to ensure that the customers and the staff inside your respective businesses are wearing their face masks and wearing them properly. All businesses, including BPOs, because you know BPOs, they don't have customers per se, but they have hundreds of employees. And so these regulations apply to them. The following regulations apply to them. So the justices of the peace will not be assigned to BPOs. So let me make that clear, because they don't have customers. But the responsibility for BPOs and other businesses still lies with the managers and owners. So they are to ensure that the employees are observing social distance among the workers, face masks at all times. They are to install hand wash stations at the entrance and within the BPO company. And they are to ensure that no more than 2 people are seated at any one table, and that during lunch breaks, the seating capacity of that particular room is up to 50% and no more. So your lunchroom cannot have everybody eating. If the capacity again is for 100, you can only have 50 workers, employees eating at that particular time, and no more than 2 at any particular table. All businesses, and this applies across the board, all businesses, including BPOs, shall appoint a COVID-19 internal auditor who will prepare and submit weekly reports to the Ministry of Health. So I want to request that the businesses familiarize themselves with this particular requirement, because every week you will have to provide information to the Ministry of Health, and they will guide you as to what you need to provide in that report. Businesses are to implement a shift system unless they are essential businesses. And essential businesses are those involved in health, tourism, banking, law enforcement, agriculture, or food. So all other businesses, if you are not essential, you must implement a shift system. Every employer of non-essential business shall implement measures to allow their employees to work from home where possible. And these employees, so even though they told you that you are to work from home, you, the employee, you also have a responsibility at that point because you're working from home. You have a responsibility to your employer. And under this SI, you are to stay home and observe all protocols, and you are to report to your employer as required or instructed. So not because you're at home means you get to go to the beach or it means you get to go to Mirab. You are working from home and you are expected to report to your employer. In relation to spas, beauty salons, and barber shops, they are allowed to operate, but the general rule is this: you can have one customer that you're attending to and one customer that is waiting to be attended to. So 2 customers you're allowed to have at any time. However, if your business is extremely small and the capacity will not allow for 2 customers in your business, you can only have 1 at any given time, and that customer, like the 2, they are to make appointments before they come to your business. Now, if you have a business, a salon that is excessively big, again, that will be there is an exception to that rule under this SI, that you are allowed to have more than 2 in your business. However, at all times, they must maintain the 6 feet social distancing. Fines on businesses. This is very important. The Ministry of Health will conduct spot checks on businesses to ensure compliance at all times. You may get visits from the police department as well. So there are 2 agencies that will be looking at businesses. The Ministry of Health will have personnel and the police will have personnel. And those businesses who are not complying could face a shutting down of your business if your customers have not been complying or your staff has not been complying with these regulations. You could face a shutdown and you could be fined $5,000. In addition to that, the employees in your business will also be subjected to a fine. I think, Madam AG, that fine is $200, the employees, $200. So business owners, $5,000, employees, $200, and potentially your business could be shut down by the Ministry of Health. They have that authority to do so. Restaurants, diners, and food vendors shall only offer takeout, delivery, or drive-through. However, there is provision again for open air, outdoor, or al fresco dining, but that must be by reservation, and you cannot go over 50% of your capacity. So if you have a restaurant that could accommodate 300 people, but it has to be outdoor, you can only have 150 people, and they all have to make appointments. They have to make reservations before they come there. I don't think there's any restaurant that could seat so many people. I'm just giving an example. Many outdoor restaurants are extremely small, so perhaps a better example would be 20. If that's your seating capacity outdoor, then you can only have 10 at any given time. The food vendors are allowed to sell, but again, continuing from the last SI, only from a private property. You cannot be on the street side selling, you must be on a private property. Schools under this SI shall remain closed, but of course they may continue to operate online and virtually. Recreational non-contact sports, tennis, golf, table tennis, or any other similar non-contact sport will be allowed. Non-contact. So basketball, you cannot play basketball. Football, you cannot play football. Any of these other sports that entails contact shall remain for the time being restricted. You cannot engage in these sports. Walking, running, or cycling for exercise will be allowed, provided that social distancing is of course adhered to. And cyclists in particular shall ride in single file only. Now this is an important one. All of them are important, but this one is very important. Anyone using public or private transportation, including operators, bus operators, conductors, of course they must wear their face masks, and operators and conductors can deny a passenger from entering onto their bus or their boat or their vessel if they are not wearing their face masks. And public and private transportation must be limited to 50% of your capacity. I know that this one is this is a new provision that is being implemented, but one that has been called for all across the country. Buses are overcrowding and no doubt serving as a super spreader, especially those buses coming from the districts that have the highest rates. And so this provision had to be implemented. You can only have 50% capacity. You cannot go over that. Hand sanitizers, and this falls on the operators and conductors of the bus or the vessel. Hand sanitizers must be made available for your passengers. And of course, social distancing must be observed while you are waiting to get on the bus or on a vessel. This is another new provision. The minister alluded to it. No person or business or restaurant can sell liquor after 6 p.m. Every single day this applies. 6 p.m. across the board. Every business that sells liquor, you are no longer allowed to sell liquor after 6 p.m. So if it is that you want to pick up a beverage before you go home, remember curfew is 8 o'clock. So please get your beverage. I know it's the time of year that you might want to get an alcoholic beverage. Pick it up before 6 p.m. Take it to your home and you can enjoy it there. The reason this has become necessary is because what we have noticed in the last weeks and months is a lot of individuals have been going to parks, have been going to the seaside in large numbers and to consume for the most part. Some of them are not, but a lot of them are consuming alcohol. So they're finding a way around the bars. So again, it is regrettable we have to take this stand, but we must. So nobody is allowed to sell alcohol after 6 p.m. Another new provision. No person shall enter or exit the Orange Walk or Corozal districts unless, so we do have exceptions to this, unless you are going to and from work or you are traveling for the purpose of food distribution or for a medical emergency. So, Madam AG, there is no inter-district traveling and there is no inner-district traveling, meaning I cannot go from the Cayo district to the Orange Walk district to purchase tacos. I cannot do that. As much as I enjoy tacos like my friend Mr. Perifit, I cannot do that. There is also no inner district commute. What does that mean? It means that you cannot, even within Orange Walk, go from one village to another village, or from one village to a town, even though it's within Orange Walk. And so we are restricting the travel to these districts and within these districts, and you can only do so, like I said, with those exceptions, meaning that you are going to and from work, and you are doing so for the purpose of food distribution or for a medical emergency. I see we have the Minister of Tourism here, and we still have the airport is going to remain open. We have made some strides in the tourism sector, nowhere close to where we need to be. And so we have to understand that this is something that we have to allow to continue. The flights into our country, especially for tourism, must continue, but we continue to have regulations in place to govern and to keep these restrictions and to have the foreign tourists subjected to these restrictions as well. So they, the foreign tourists, will still be obligated to reserve or book a hotel that is approved. You must be an approved hotel or resort in order to have a booking. You must make that booking, and in addition to that, you must make arrangements for you to get to that hotel. So your transportation must also be arranged. You might be wondering, how could you enforce that? Well, when you arrive, in addition to being subjected to the PCR testing at the airport, you will also be asked by the authorities to provide the proof of your booking and the proof that you have made transportation arrangements to get to your hotel. So anybody who is not in compliance with the above, including, and there's still the obligation for you to provide as a foreign tourist a PCR result that was given to you within 72 hours of your arrival. If you do not have that, you will have to take the PCR test at the airport. The rapid test will be administered to you at the airport. Sorry, 1 second. So I've just been informed that you must have the test results within 4 days of your travel. 4 days. So the test results can be 4 days instead of 72 hours of your travel. I know that a lot of the states, especially, have a time frame within which they provide their results, and it is 4 days. So that is what you will have to provide. A test result that was done within 4 days of your arrival to Belize. If you don't have that, you will be subjected to the test here in Belize. So if you don't have your booking at the hotel, if you don't make transportation arrangements to your hotel, and if you refuse for whatever reason to take the test, or you did not bring a test, you can be denied entry into Belize, and you will have to pay your transportation costs back. And the rapid tests, let me just make another clarification. The rapid tests would have to be within 48 hours. So there's a distinction made between the PCR, which can be 4 days prior to travel, and the rapid test 2 days, 48 hours before your arrival to Belize. So those are in the SI. If you test positive, You will be placed in a mandatory quarantine, one of the centers designated, one of the hotels designated by the government. So whether you're Belizean or whether you're a tourist, you will be placed in a mandatory quarantine. I think Belizeans, Madam AG, are allowed to stay at home but in quarantine. But tourists, there will be designated quarantine centers for them, and they can only come out of those quarantine centers, and it applies to Belizeans as well. You can only come out of your mandatory quarantine if you are discharged or declared recovered by the Ministry of Health or a healthcare professional using the guidelines from the Ministry of Health. The entry through land and sea ports remains closed except for cargo shipments, emergency medical travel, which must be approved by the Ministry of Health. You must get approval if you want to go through one of our land borders. Ministry of Health must clear you that you do have a medical emergency and it is required for you to travel. They will give you that clearance. You cannot go otherwise. Medical students returning home, specialists required to assist in Belize, business people with special interests in Belize, diplomats, holders of valid work permits. These people can come in, however, they need permission from the Ministry of Foreign Affairs or the consulate in order for them to come to Belize. So land borders otherwise remain closed. Otherwise, if you cross the border without this permission, you are considered a border jumper. And so we do have legislation, similar legislation as before as it pertains to border jumpers, and a similar, I believe it is a 3-month sentence. 3-month sentence if you are a border jumper. So my advice, do not try to come across any of our land or sea borders without getting the requisite permission, either from the Ministry of Health or from the Ministry of Foreign Affairs. So that is a summary, even though it was pretty lengthy, a summary of what our measures are today under the SI. I want to join the Minister of Health in wishing all Belizeans a very safe Christmas. This is not going to be the last Christmas, guys. There will be more. So let us just be safe, at least for this one, while we work to containing the spread of COVID-19 in Belize. Thank you very much.
Thank you, Minister Musa. At this time, we'll go into the Q&A segment. As usual, we're asking members of the media to first introduce themselves, identify the media house you represent, and then begin with your questions. We ask you to keep the questions as short as possible. You will be allowed initially 2 questions, and then we'll come back for a round of 1 question each. We'll begin with Aaron Humes. Aaron? Aaron, are you there? Can we move on then to Courtney Menzies? Just a minute, Courtney. Just give us a minute, Courtney. We're just trying to sort out the audio here. Can you go ahead now, Courtney?
Can you hear me?
Yes, perfect.
Okay, so my first question has to do with the 50% capacity for buses. We know that buses, they're already complaining that they have to put less buses on the road, less runs, and they're losing money. Now it is 50% capacity.
Percent of the business that they would be losing. So we have to find ways, creative ways, in order to subsidize the bus operators. So that is something that we are addressing at this very moment. And I'm hoping that by Monday, latest Tuesday, we can have a resolution on that particular issue.
Okay, the second question is again for you, Minister Musa. How do we ensure officers do not take advantage of this new ticketing system that's coming into place next year, as well as the regulations that will come into place, now, starting the 20th?
Well, any system that you have in place, there must be checks and balances, and any system can be abused, even the current one as it exists. I can tell you that a number of individuals can have told me that in fact police officers have given them a break, so they have used their discretion and have not charged them. So it really comes down to discretion, Courtney. It comes down to the discretion of the officers that are enforcing these requirements and these regulations. And so any of those systems, whether it's a ticketing system or whether it's an officer threatening to take you to the police station, one could argue that is even more severe. That if an officer comes to you and says, Courtney, I am going to arrest and detain you and put you in the piss house, but on the side you could give me $100. That is even a greater threat on you, Courtney, than one saying, I'm going to give you a ticket of $500. And so any particular system that's in place is open to abuse. But at the same time, this particular measure has become necessary because the police department, like our healthcare frontline professionals, are getting infected. Currently, we have 160 police officers who are COVID positive. We have another 145 of them who are awaiting their results. And so what we have seen is that the engagement with the public, we have to find a way to minimize that because from detaining someone and taking them to the police station, that's a lot of time that you have to be interacting with members of the public. And it's not just a safety measure to protect police officers, but also to protect you, a member of the public, so as to ensure you potentially don't get exposed to COVID that a police officer might have at that particular time. So we find that it is necessary at this time in order to introduce this new system. I fully anticipate that there will not be that abuse, but of course, we do have a professional standards branch that the public can make their complaints to. In addition, we have a civilian board that oversees the professional standards branch. So we do have these checks and balances in place, and it is my hope and anticipation that we will not be having abuse.
Right, thank you, Courtney. We'll now move back to Aaron Humes. And just as a reminder to the members of the media, kindly identify the media houses you represent as well before you proceed with your questions.
All right. Am I on now?
You're good, Aaron.
Okay. Thanks, guys. Aaron Humes from Breaking Belize News. To Minister Shabat, what serious consideration, because I missed the start of the press conference, what serious consideration was given, if any, to having a lockdown, and especially in the Corozal and Orange Walk area? I noticed that it was mentioned that those districts are effectively sealed off in terms of travel. Not quite a lockdown, but very close to it. So what serious consideration was there to completely locking down that productive area of the country?
Well, I'm not sure what serious considerations were given, but I think I went into length in trying to explain the level of transmission in those districts in particular. I believe the last rate of transmission I saw was for every person infected, they are infecting an additional 15 persons in those districts, while in other districts that is about 5 persons. And so unfortunately in the northern districts we have a huge amount of transmissions. I even went through naming the villages where we have the highest rates of transmission. So this decision was not made lightly nor easily. We understand the difficulty it may bring on our residents in those districts, but the data that the ministry has is what militated for us to enact these measures in the northern districts.
Okay, and then the second question is there any update with regard to the distribution of packages and stipends for those persons and those families who have been impacted by COVID-19 and a positive diagnosis?
Yes, the distribution of packages has begun, and we're doing that in collaboration with the Ministry of Human Development.
That's it. Thank you.
Thank you, Aaron. At this time, I'd like to invite Dion Vanson.
Hello, good morning. Can you guys hear me?
Loud and clear.
Hey, good morning. My name is Dion Vanson from the San Pedro Sun. And I have a question. This question can be for Minister Musa or Minister Chebat. You know, those that test positive at the PGIA, how are they reported? Like, do they come in the daily reports? And how many will you say test positive per day?
Yeah, so all the tests being conducted throughout the country, all the results are fed into the Belize Health Information System. And people coming through the airport, similarly those who are tested, all the tests are reported, and so are the negative and the positive tests arising out of the airport. They're all included in the cumulative numbers that we're giving on a daily basis. If you want particulars in terms of the number of positive cases, I can ask Nurse Perez to give you the data on that if you wish to have that.
Okay. And once a tourist tests positive, are they sent to the quarantine center or they go to their hotel?
Well, the hotel that they book should be one that is able to provide for quarantining, and so they are directed to their hotels to quarantine.
Okay, I have a my other question, which is very concerning here on the island, since now the new regulations, or the regulations at the moment, will see some businesses like bars still closing, still closed. What sort of stimulus package is in place for those businesses and employees who once again continue to stay on lockdown because their businesses cannot open? um, how do we determine poverty if people who may seem to have a home, or etc., these people might be in danger of getting their utilities or other necessities cut off because of these extended restrictions. So is there some sort of stimulus package for these persons that continue to be unemployed or cannot really function because of these restrictions?
Yes, these are difficult circumstances and times for all of us, and we are all having to make adjustments and sacrifices. And I believe that the government has just reinstituted. I think it's called the BCAT. Sorry. Yeah, they've just instituted a financial program where persons who are unemployed and have lost because of the COVID can apply online to access some funds.
Okay.
Thank you.
Anything for the businesses, like employers?
Those are continuing discussions that we're having, and hopefully Cabinet will be able to make a decision on that soon.
Right. Thank you, Dion. We'll now move on to Marisol Amaya. Marisol, are you online?
Yes.
Can you unmute? Okay.
Yeah, I've already done so. I believe Marcela Maya from News. I believe this question would be directed to the Minister of Health and Wellness. In considering travel restrictions for the Curacao and Orange Walk districts, why were the Belize and Coyote districts not included in these restrictions? If you look at the numbers of infections, at least what I've seen for the last few days, the Belize and Coyote districts have had many more numbers than what Orange Walk and Curacao are registering. But have you looked at population size, perhaps to exclude the Belize and Coyote districts from any such restrictions?
As I said earlier, I think Aaron had asked the question, Marisol, and we looked at the districts that have the highest rates of transmission over a period of time, and that is how we singled out or identified both Corozal and Orange Walk as having the highest rates of transmissions.
Okay, and what will be Dr. Manzanero's position? You've spoken about the team that's been put together, but I didn't hear his name mentioned. I know the last thing you said was that you were in discussions with him as to where he would best fit, but then after that he had to be hospitalized.
He still is, and as I have said many times to the media, the conversation with him is a continuing one.
Thank you, Marisol. We'll move on to Paul Lopez.
Hi, good morning to the head table. I think just for a bit of housekeeping, there's one reporter whose mic is still unmuted and it may be causing a bit of audio distraction. So thank you for muting your mic. So once again, good morning to the head table. I have a question on vaccine. I may have missed some of what the Minister of Health mentioned earlier, but would you be able to speak to a possible timeline for vaccine? For example, how much of the population will be reached or you're attempting to reach initially? And I believe you mentioned it, I may have missed it. And what is the goal or hopeful reach over an extended period? And particularly, what brand of vaccine are we pursuing?
Yes, I am going to defer to Dr. Bear so that she can answer that for you. Doc?
Many thanks for your question. As Minister Shabat mentioned earlier, we are procuring 238,800 doses of vaccines, and that will cover the initial 30% of the population that we intend to vaccinate. The vaccines, we are engaging through the COVAX facility, which is a specialized agency, along with the World Health Organizations and other specialized agencies in vaccines. And they are looking at the different vaccines that are under production. There is more than 154 vaccines that are being produced. They have shortlisted currently 9 vaccines, but we still have to wait on the result of these 9 vaccines that they have enlisted currently. And once the decision is made, then Belize will have access to the vaccines. In regards to the timeline, we are looking at April 2021. And with the COVAX facility, we are ensuring access to quality vaccines. I must mention that the COVAX facility have currently more than 90% of the countries around the world sign up to them. Thank you.
So as a quick follow-up, if you wouldn't mind, Doctor, this 30%, it's an initial amount, because I'm not too certain how vaccines work in terms of how much of the population has to be vaccinated.
Well, if we do the maths with the amount of doses that we are procuring, it's to cover 119,000 Belizeans. And we have different target population. The priority will be those at higher risk, frontline workers, especially the Ministry of Health staff that is dealing directly with the positive cases, followed by elderlies and persons with chronic diseases. So we are working on those numbers. We have a National Immunization Technical Advisory Group that is looking at the proposal that we are putting together, and we will be sharing it with you all later.
Thank you. As for my second question, thank you, Doc.
Thanks.
My second question, I understand that the tourism minister is there as well. And I just wanted to get some clarity on one of the regulations that is in place as it relates to foreign tourists. They must book a standard hotel. That's what the Minister of Home Affairs mentioned. He left out the gold standard part. I don't know if that's intentional or not. And that they must arrange to get to the hotel transportation. So my question is whether or not this inner district or outer district travel restrictions, whether it will be enforced for tourists as well. Must they remain at the gold standard hotel? And these gold standard accommodations, are these certifications still being issued out?
Yes, nothing has changed with regards to the gold standards. Tourists still have to stay there at one of those properties. And no, it doesn't apply to tourists.
So tourists can travel across the country freely?
Yes.
Thank you.
Thank you. We'll move on to Mr. William Isagire. Can you unmute your mic?
Good morning, everybody. Welcome back, Minister Marla. I'm glad to see that you have recovered and you're out of quarantine. Minister Shabat answered my question with respect to how soon or how we were acquiring the vaccines, and Dr. Larry Espada answered my query with regard to when the vaccines would arrive. And those were my primary concerns. Pretty much everything has been addressed by previous speakers. Merry Christmas. Thank you very much.
Thank you. Isane, you're up next.
Good afternoon. Are you guys hearing me?
Yes.
Okay, my first question has to do with the prohibitions on inter-district travel. I know that there is limited local tourism happening in and across the country. Let me put it that way. Are there any considerations for this kind of activity, considering that some businesses are, holding on by a thread to the income that they get from local tourism? May I put that to either Minister Mahler or the Minister of Home Affairs?
Hi,
Or the Attorney
good
General, for that
morning,
matter.
Isani. With the inter-district travel, the international tourists will be allowed inter-district travel, not for local tourists, all right? This was a weighted decision. I mean, a lot had to go into it, but the fear is that if locals become tourists and wanting to go to the next nearby village. So because of that concern that it may be abused and the seriousness with which we have to restrict travel, it's only international tourists who will be allowed to travel to Orange Walk and Curacao. On tours, of course.
Thank you, AG. My second question is primarily for clarity. This is for the Minister of Home Affairs. I know that you listed several of the businesses that were considered non-essential, but I believe the media is one such industry that some of us do come off work a bit late. Will we be allowed passes beyond the 8 o'clock curfew time? That's one. And two, the issue of the shift system for non-essential businesses. Can you also provide some clarity on that?
Just remind you, Isani, essential business is defined under the SI, and it means any business involved in tourism, health, banking, law enforcement, agriculture, or food. And as I mentioned earlier, any other entity, any other employee of a business, through their employer, may request a badge pass from the Minister of Home Affairs, or someone that I may direct can issue a badge pass to you. So it is on a case-by-case basis. We are trying to, as best as possible, limit the issuance of these badge passes. So you have to apply through your employer to get that badge pass in order to travel beyond the 8 o'clock curfew hour. So that is something that your employer will request on your behalf, and it will be assessed by the Minister of Home Affairs, myself, or somebody designated by me in order to issue that badge pass.
Thank you.
Thanks, Isani. Next, we have Alberto Veos.
Good afternoon, everybody. So we don't know how the lockdown discussion ended in cabinet. Considering that this is the closest any measure has gotten to a lockdown, or at least partial lockdown for the Corozal and Orange Walk districts, is it the belief that if the numbers continue to surge, possibly the next step could be that which we are trying to avoid, establishing a full lockdown for these districts?
If I may answer this, clearly, Mr. Veyos, these measures are intended to curb the transmission of the virus. And if we are not able to attain that, then clearly all options are on the table.
My next question is for the Minister of Home Affairs. The Christmas season in northern Belize triggers a heightened activity in contraband, and we have continued to receive reports of contraband items appearing in a number of the communities close to the border in Orange Walk and Corozal. In Corozal, for example, Consejo has a Coast Guard facility, has a customs facility, and we continue to get reports that there are numerous contraband activities happening. Is there an intention from the Ministry of Home Affairs to increase the monitoring and control of the border areas?
That has not stopped. Roberto, as you know, we have a very porous border, a huge border with Guatemala, with Mexico, and so it is virtually impossible to expect the police department to be monitoring every single possible entry point. But we have been vigilant in our monitoring of the known border points. So I can tell you that that will continue. Of course, it's like I said, not possible, not feasible for us to monitor every single entry point, but we continue to do so. And like I said in the presentation earlier, it is still a serious offense to border jump. It is illegal and you will be sent to jail. So we have to make that very clear. Nothing has changed in that regard. A 3-month sentence if you are caught border jumping.
I will ask my third question, happily knowing that we will get another round.
No problem,
thank you.
That's fine.
Thank you guys for that. My third question has to do with the introduction of GAPs as a sort of monitoring unit. However, we know that GAPs do not have arrest and charge authority. So maybe Minister of Home Affairs or the Attorney General, can we get a clarification as to how that will work out? Will they still have to pass on reports to the police? The police will still have to move in, or will GAPs be given new authority?
Yes, they do not, like you said, have the powers of arrest, Alberto, but we are going to be cooperating. The GAPs, are going to be cooperating very closely with the Belize Police Department. We now have an actual COVID task force that is assigned. So we have police officers across the country, 24 in the Belize district and 8 in each of the other districts that are assigned specifically as COVID task force officers. So these JPs, in their monitoring and supervision of the stores, will report to these particular officers in the event there is blatant violation of these restrictions within the stores. The JPs do have authority to direct that the individuals space out, that they wear their masks properly, and if necessary, report any blatant disrespect or violation so that the police can come and make an arrest. So there will be that liaising between the justices of the peace and the police department in terms of monitoring and detaining individuals who are breaching.
Will it involve any type of remuneration for their work?
Yes, the employers of those businesses will be responsible to pay for the service, and the payment will go to the JP Association.
Thank you, Alberto.
Thank you.
So as promised, we're giving members of the media an extra question. So we'll go back up to Courtney Menzies. Courtney, do you have another question?
Yes, I do. This is concerning the vaccine. The 238K vaccines that's promised or that will be expected to come into the country. Is it a situation where these vaccines can only cover 30% of the population, or will the first amount be given to 30% and the rest be sold to other members who can buy it to other residents?
No, no. I think you misunderstood. The initial amount is to cover 30% of our population, and there is a planning process in place to determine. I think we've identified who among us will be getting initially. So it's to obtain 30% for the entire population initially, right?
Thank you, Courtney. Aaron, if you have an additional question. All right, we'll move on to Dion Vanson.
Hello, morning. My question has to do with the restrictions for traveling, like the inter-district. Here on the island, San Pedro, we have a lot of people that they come to the island to work, and then they go back home like for holidays. Is how will that work? Will they be able? Are there any restrictions on people traveling back home that are on the island and just part of the labor force? And will the 50% capacity that is allowed on like the buses on the mainland will also apply for the boats that are traveling to the island from the mainland?
Okay, in relation to your first question, the exception to the inter-district travel includes to and from work. So if those persons on the island are returning home from work, they are accepted from the inter-district travel restriction. In relation to your second question, it is any public transportation, including buses and vessels, which includes your water taxi as well.
Okay. Can I ask one more question? We didn't hear anything about construction sites. Will they be allowed to open?
Thank you, Dion.
Yes.
All right. In relation to construction work, they are not restricted from working. But they are subject to all other restrictions, including curfew.
On to Marisol.
Thank you. Has the waiting time for rapid tests being done at the Philip Wilson International Airport, has that been changed?
That is a work in progress. The Minister of Tourism and I visited the airport like maybe 10 days ago, I believe it was. And we're looking at the processes there and to see how we can improve and to cut back on the waiting time. So we're looking at those protocols that are currently in place.
So are you able to say how long they are waiting currently?
The waiting time from the time you get off the plane until the time you leave, it's taking about an hour and a half to almost 2 hours in most cases.
Thank you, Marisol.
And that is for the process that was there before, catered to 2 flights. Like yesterday we had 5 flights. Tomorrow I've been told that we have 10 flights. And so we've added additional people to work those flights to help the Ministry of Health. And so we're taking care of the bottlenecks that are at the airport currently.
Right, Paul Lopez.
All right, Paul Lopez, Plus TV. So many questions, but I'll just ask one final question. But maybe just for housekeeping, can it be stated the timeline of this new SI? Maybe I missed it as in terms of, is it indefinite? How long will it remain in place? And my question is, can any of the health experts on the panel speak to whether any preclinical or clinical studies are being done locally for possible COVID-19 treatments? And if any, what have those results yielded? There are reports, I understand, that the drug Ivermectin may be yielding some positive returns on COVID-19 positive patients in Belize.
Just respond to the first part. DHS, may I just respond to the first part of the question in relation to the SI? The SI comes into effect on the 20th day of December, and it is in place until a new set of regulations are passed.
Thank you.
Yes, good afternoon, everybody. With regards to the ivermectin, we have recently placed ivermectin as well as convalescent plasma on our protocol. And this has been done because there is evidence. It's not necessarily studies done here locally, but we do know that worldwide, a lot of countries have actually done a lot of research and studies into ivermectin, and it has been placed in the protocols for many countries, including the United States as well. It is an off-licensed drug, so that's important. It is not licensed for the use of COVID-19, but research and articles have shown that it has improved both for prophylaxis, mild, moderate, and severe care. And for that reason, our COVID medical response group met, and we made a decision to place it on our protocols starting from last week, and we have procured the medication as well. And we are actually in discussion to start doing this research. We know certain parts of the country it has been used a bit more than others, so we can definitely retrospectively look at the persons who have started ivermectin and actually do our own research in country to determine whether or not it was effective or it is effective.
Oh, this is on a voluntary basis, correct?
Well, it's not mandatory, but it has to be given by a prescription. You should not go out and purchase ivermectin on your own. And before you're given it, you would be explained by the medical practitioner or the person prescribing exactly what the use of the medication is and how it works and what the contraindications are. Thank you.
Thank you, Paul. I don't see Mr. Isagira online, so we'll move on to you, Isani.
Thanks again, Janelle. My question is for the Acting Director of Health Services, if she can provide us with information regarding the present capacity at the KHMH in terms of either persons on ventilators or persons who are presently hospitalized with COVID.
Yes, Isani, we have Dr. Sosa with us, and we're going to ask him to respond to your question.
No problem at all. Thanks.
Good morning. Thanks for your question. Presently, at the KHMH, we have capacity for 36 patients with COVID-19 and patients under investigation for COVID-19. We have planned to expand further the capacity, and we hope to be able to accommodate for 45 patients total. Of course, to do so, we will need to have more personnel and the equipment that goes with treating those patients. So that is why up to now we have 36 patients capacity. Now, in terms of specific questions as to patients who we might have hospitalized, for today, I can tell you that there are 17 COVID-related patients admitted at Carl Huchner. Of those, 12 are confirmed cases of COVID-19. 5 of those patients are being ventilated. Additionally, we have 5 patients being investigated for COVID-19, but we don't have diagnosis as yet to confirm that indeed they are COVID positive. Do you have any other follow-up question to that?
That's it, sir. That's fine. Thank you.
Thank you.
I believe that wraps up our question and answer segment. I'd like to thank the public for tuning in, those at home and abroad, members of the media for joining us today, of course, the members of the head table, before we sign off, Minister Shabat does have some words to share.
Just very briefly, in my presentation, at the commencement of the press conference, I had mentioned the names of those organizations who have been assisting us, and I failed to mention the Red Cross, who have been incredible partners, and it would be remiss of me not to pause and to recognize the great work that they have been doing and the assistance that they have been giving to the government and to the Ministry of Health. And so before we leave, I just wanted to recognize them and to thank them for the work they do here in Belize. Thank you.
Thank you, Minister Shabat. Again, I'd like to thank the members of the head table, Honorable Michelle Shabat, Honorable Karim Musa, Honorable Anthony Mahler, and the Attorney General, Honorable Magali Marin Young, as well as other members of the head table here with us today. Before we sign off, I'd just like to remind you of the COVID Christmas campaign that was officially launched yesterday by the Ministry of Health under the theme, "It is better to have a safe Christmas season than to attend a funeral during the holidays." With that said, we'd like to remind the public to continue to follow all the regulations set out by the Ministry of Health and Wellness, to continue to wear mask coverings over both your nose and mouth at all times in the public, to stay at least 6 feet apart from others at all times, to wash and sanitize your hands wherever possible, of course, to stay at home as much as possible unless absolutely necessary. Of course, you're also encouraged to please call the Ministry's toll-free number 0800-664-2273 for guidance on COVID-19. With that, I'd like to wish you a safe and Merry Christmas on behalf of the Ministry of Health, the Government Press Office, and the wider GOB. Thank you very much.